to the second session of the Dendrite program. I welcome our Executive Director, Dr. Madhvanand Kar Sir, Professor Kuldeep Singh Sir, Dean Academics, AIIMS Jodhpur, senior faculties and other participants. Like we know, the Dendrite program integrates the activities of all the other clubs. The theme of today's program is making learning enjoyable. And as we all know, this program is of the students, by the students, and for the students. So in today's session, we'll be having brief discussions and talks by our undergraduate students, postgraduate students, and our panelists, which includes our esteemed faculties, and last but not the least, our today's guest of honor, Dr. Rajiv Bagrita Sir. Now I would like to request Professor Dr. Kuldeep Singh Sir, HOD Pediatrics and Dean AIIMS Jodhpur, on stage to enlighten us about the program.
Good evening, everyone. And on behalf of AIIMS Jodhpur, I welcome you all. Honorable Executive Director, Professor Madhvanand Kar, guest for today's presentations and the guest talk, Professor Rajiv Bagrita, Principal SMS Middle College, Jaipur, and Mr. Azad, Principal College of Nursing, Dr. Suresh Sharma, all the faculty members from the different departments, the panelists, and my dear students. एक और बात मैं कहना चाहूँगा कि आज हम लोग के बीच में कुछ स्टूडेंट्स हैं जो जालौर से नवोदय विद्यालय के यहाँ पे आए हुए हैं, एंड उनको भी हम लोगों ने इनवाइट कर लिया कि एक प्रोग्राम हम लोग का कैसा होता है, तो दे विल ऑल्सो गेट एन आइडिया कि एक डेंड्राइट प्रोग्राम है. मैं थोड़ा सा बस बताना चाहूँगा व्हाट इज मेंट बाय डेंड्राइट. जो हमारा नर्वस सिस्टम होता है, स्नायु तंत्र होता है, उसमें एक्सॉन्स के बाहर निकले हुए कुछ तंत्र होते हैं जिनको बोलते हैं डेंड्राइट. और सबसे खास बात ये डेंड्राइट की ये होती है कि ये लाइफ लॉन्ग ग्रो कर सकते हैं. जितना हम सोचेंगे उतना ये डेंड्राइट और ग्रो करेंगे. जितना हमें एक्सपोजर मिलेगा, एक्सपीरियंस मिलेगा, उतने डेंड्राइट और इंटरकनेक्ट होंगे. तो इसी कॉन्सेप्ट को लेते हुए हमने इस प्रोग्राम को डिजाइन किया है कि हमारे जैसे न्यूरॉन के डेंड्राइट्स इंटरकनेक्ट करते हैं, वैसे ही हमारे स्टूडेंट्स की बहुत सारी एक्टिविटीज होती हैं. एम्स जोधपुर है, काफ़ी स्टूडेंट्स फ्रेंडली है और हम चाहते हैं कि हमारे स्टूडेंट्स हमेशा एक्सेल करें. लेकिन कुछ चीज़ें हैं जो उनको बाधा उत्पन्न करती हैं, एंड दे डिस्ट्रैक्ट देम फ्रॉम अचीविंग देयर फुल गोल एंड होलिस्टिक डेवलपमेंट. और उसमें एक ये होता है, बहुत सारे स्ट्रेसर्स हमारे लाइफ में होते हैं. हम लोग बहुत जल्दी परेशान हो जाते हैं छोटी छोटी चीज़ों से. हम शॉर्ट टर्म सोचते हैं, हम लॉन्ग टर्म कभी सोचते नहीं. आगे हम हमारा पर्पस क्या है लाइफ में, ये हम सोचते नहीं. तो ये डेंड्राइट के थ्रू इसका भी है कि हम इंटरकनेक्ट करें. अंडर ग्रेजुएट स्टूडेंट जो MBBS और BSc ऑनर्स नर्सिंग के हैं, पोस्ट ग्रेजुएट स्टूडेंट ऑफ द डिफरेंट स्पेशलिटीज एंड द MSc स्टूडेंट्स ऑफ कॉलेज ऑफ नर्सिंग, और हमारे PhD हैं, मास्टर्स इन पब्लिक हेल्थ हैं, ये सारे लोग, और जो DMMC के स्टूडेंट्स हैं, ये सारे लोग एक तरह से अगर जुड़ते हैं तो एक दूसरे को हेल्प करने से हम आगे और ज़्यादा बढ़ सकते हैं. एक टीम फॉर्म हो सकती है, हमारी जो क्रिएटिविटी है वो और एनहांस हो सकती है. हाउ दिस क्रिएटिविटी कैन बी यूज्ड इन आवर लर्निंग ऑल्सो. सबसे ज़्यादा पहली बात तो ये कि हम लोग का जो मेडिकल प्रोफेशन है बहुत स्ट्रेसफुल है, बहुत लंबा भी है, एंड समटाइम्स बहुत सारी चीज़ें हम लोग के एक्सपेक्टेशन सोसाइटी की होती हैं, और वो बहुत कुछ कभी कभी मुश्किल होता है. और ऐसे में अगर हम अपने आप को पूरा संतुलित रखेंगे, बैलेंस रखेंगे, और ये हमारे न्यूरॉन्स पर डिपेंड करता है, नर्वस सिस्टम के कैसे कनेक्शंस हैं, हम कैसे स्ट्रेस को बर्दाश्त कर सकते हैं, सह सकते हैं, ये भी एक डेंड्राइट का फंक्शन है. तो ये जो हमारे डीन स्टूडेंट वेलफेयर के अंडर में बहुत सारे क्लब्स हैं, उन क्लब्स के थ्रू, और प्लस हमारी जितनी भी एकेडमिक एक्टिविटी होती है, शिक्षण जो होता है, हमारा एग्जामिनेशन प्रोसेस होता है, रिसर्च प्रोसेस होता है, और साथ में हमारे जितने भी प्रोग्राम्स होते हैं, एनुअल प्रोग्राम्स होते हैं, स्पोर्ट्स एक्टिविटी, तेजस है, ऑरा और एस्टीरियन, इन सब को भी मिला के हमने ये कोशिश की है कि इसमें स्टूडेंट से इन्वॉल्व हों. स्टूडेंट जो हमारे UG हैं, हमारे पोस्ट ग्रेजुएट्स हैं, वो आपस में एक दूसरे से कनेक्ट हो जाएं और वो इस प्रोग्राम को कंडक्ट करें. तो इसी पर्पज से हमने इस डेंड्राइट प्रोग्राम को, और उसी श्रृंखला में ये हमारा दूसरा एपिसोड है. फर्स्ट एपिसोड हम लोग का 10 अक्टूबर 2023 को हुआ था, और उसके बाद हम लोगों ने हर 2 महीने पे एक एपिसोड करने का. और फॉर्चुनेटली आज हमारे बीच में एक स्पीकर भी अवेलेबल है, डॉक्टर राजीव बगरट्टा, जो हमें बहुत सारे और इनिशिएटिव इंफॉर्मेशंस देंगे जो हमारी लाइफ में और हमें आगे बढ़ने में मदद करेंगे। तो इसी के साथ मैं आप लोगों का अगेन स्वागत करता हूं इस हमारे डेंड्राइट प्रोग्राम में, जो लेटर ऑन इसको हमारे स्टूडेंट्स ही बाद में कंडक्ट करते रहेंगे, और इसी के अंदर एक्टिविटीज हमारी हैं यूजी एंड पीजी के प्रेजेंटेशंस। तो लेट अस सी दिस प्रोग्राम, एंड आप लोग इसमें पूरी तरह से पार्टिसिपेट करिए, पूरे मेंटली पार्टिसिपेट करिए। यू आस्क क्वेश्चंस, जितने आपकी क्यूरियोसिटी होगी उतने आपके डेंड्राइट बढ़ेंगे और इंटरकनेक्शंस और नेटवर्क बढ़ेगा। थैंक यू।
Thank you so much, sir, for your encouraging words of wisdom. Now, I would like to invite our first speaker, Dr. Nirmit Patel, who is about to complete internship in AIIMS Jodhpur and has secured a remarkable rank in the recent INICT.
Good evening, everyone. Hello, Director Sir, our esteemed guests, the dear seniors and fellow colleagues. This is Dr. Nirmit, currently pursuing my internship in AIIMS Jodhpur, and I'm about to join PG in the next session. So the topic for today is making learning enjoyable, an approach for an undergraduate student. So before joining the college, we have a perception that MBBS is a long process, just about studying and studying for around 10 years, 15 years down the lane. So how can we make this journey a memorable one and a enjoyable one? So it is just a few slides for that. So this is how we pursue medical education from outside, like a series of lectures, postings, and group studies and all. And this is how we become in the final year, just surrounded by books, quoting the things that are written in the books in the exams, and just revising stuffs and all. So in 2021, NMC gave a curriculum for the MBBS, the new curriculum for the MBBS, that is the competency-based medical education. So competency-based medical education focuses on making a medical student a doctor that approaches a patient, treats a patient, manages the patient in the knowledge-based way, also showing the compassion and the empathy towards the patient, and relating to the problems and solving them. So this competency-based medical education is particularly an individualized thing. It is based on the theme of self-learning, like how you are going to approach a patient when a patient comes to you, rather than solving a problem that is the patient presents, like solving an MCQ or solving an exam question. That is not the basis of this medical education. The basis of medical education is to how to treat a patient when he approaches you. It is a workplace-based medical education, like not a library-based medical education. So a medical student goes for clinical postings and learns from the seniors and faculties on how to approach a patient. It is also a learner-centered perspective, that you have to learn it by yourself and someone does not force it on you. It is outcome-based. It is integrative. So a person makes concepts or builds concepts knowledge about a particular case or a particular disease and integrate it from all the perspectives there is from different subjects, different backgrounds and all. It is time independent. It means that from the first day as the medical student enters the college, he has to start learning this competency based program. So it continues through the 5 years of his MBBS and during the postgraduate also. So it is based on milestones and not timelines. This is a Miller's pyramid of competency evaluation. So it focuses on 4 things, that is knows how, shows and does. So during our MBBS curriculum, we are that is a common practice that we only focuses on what is knows and knows how. We do not focus on how the shows and the does part occurs. So we only are focused on the cognition part and not the behavior part, which is wrong. So we know that it forms the base of all, but it does not form the complete pyramid. So we have to focus on the behavior part as well. Fact gathering and interpretation and application are all tested in our professional exams, but not the shows and the does part. The demonstration of learning simulations, OSCEs, and workplace-based assessment, they are not been covered as a whole in our medical curriculum. So there is a thing that people say that medical education is only about रट्टाफिकेशन एंड रट्टे ही रहो, पढ़ते ही रहो, पॉइंट्स याद करते रहो और याद करते रहो. इट डज नॉट सपोर्ट दिस. द रोट लूप continues as the professional exam occurs. So there is a preparation phase. The student wrote everything, and then there is an exam. So he vomits everything in the exam, and then he forgets. So there is no end point to this. This rote cycle continues, and there is no gain in this cycle. So we have to focus on concept building rather than rote learning. So concept building will help you relate and integrate multiple things during our postings. It also helps in problem solving. It focuses on deep learning rather than recalling facts in front of patients and treating the patients. So rote learning is a long, tedious, less fruitful process, while concept building is helpful in building interest and initiates for integrative learning. Cognitive learning, which we all do in our MBBS. There are some interesting approaches that we can apply for cognitive learning for making it easy and bearable. So there are multiple quizzes being conducted in AIIMS, which focuses on personal learning and expressing their knowledge. There is unconventional learning experiences, which was implemented in AIIMS during my MBBS, and the conventional way of learning, like presentations and boards, were abolished, and it was more based on videos, demonstrations, and other approaches. Integrated teaching classes, compiling of multiple departments and discussing on a single topic, was also helpful. There is a DOPE approach, that is demonstration, observance, assistance, and performance. Like a demonstrator, for example, a surgical skill has been demonstrated by a demonstrator or a teacher. The pupils of the class observe the procedure, they assist during that skill development, and they perform themselves. There is also clinical case-based learning sessions that happens in AIIMS, like CGR sessions on Wednesdays and Fridays, which are also helpful. A skill lab has been established in AIIMS. Also, a major helpful thing in the MBBS curriculum teaching is learning by teaching. Like a group of friends or colleagues sit together and they teach something to each other. So that is also very helpful during the medical curriculum. So Benjamin Franklin said that, tell me and I forget, teach me and I may remember, involve me and I learn. So tell me and I forget, like in clinical postings we are taught many things and we are told that this happens, and we just hear and we go home and do not do anything. So that is a wrong way of approaching things, that you only will recall that thing 1 or 2 days and you will forget that. But if we are taught in a particular way, in a good way, then we will remember. And if we are involved in like demonstrations and in the education, then we will definitely learn. So a clinician is made of knowledge as well as empathy. We only focus on the knowledge part, but there is the empathy part is somewhat forgotten in our medical education. We are not been taught about the empathy part. So a patient is not an exam question that needs solving. Patient is a human being in pain who comes to us with a hope that we will listen to his pain and heal him. So we are required to learn and show compassion, humbleness, and treat them as they desire. Thank you.
Thank you, Nirmit, for your inspiring words for your junior. We wish you a bright future ahead. Now, I would like to request Dr. Kandha Kumar, Senior Resident, Department of Pediatrics, on stage for a brief discussion on Road to Happiness in Post-Graduation.
Very good evening, everyone present here. Myself, Dr. Kandha Kumar. I'm doing my senior residency in the Department of Pediatrics here only. I have just completed my post-graduation. So let us have a brief discussion about the road to happiness in post-graduation. As I have completed my post-graduation very recently, I will also share my personal experiences in this talk. So what is happiness? What is the real happiness during post-graduation? So no matter what branch we choose, being it a preclinical, paraclinical or clinical branch, the efforts we make during our post-graduation, the hard work we do will be directly converted to someone's happiness. Actually, if we realize this fact, no matter how stressful the environment is, jitna bhi stressful hai, jitna bhi workload hai, definitely it won't be so much tiring and we won't regret all these works we do. If we realize this fact, this is the first and foremost thing that we should fix in mind. जो भी हम काम कर रहे हैं, that will be directly converted into someone's happiness. Someone is being benefited, no matter branch we take. Despite there are some factors which will hamper our happiness during the course of our post-graduation. First and foremost is personal satisfaction. So it is related to the choice of branch. So during our MBBS time, everyone, we will be having some passion and interest towards a particular branch, and we will be damn sure that अगर मैं PG करना है तो सिर्फ इसी branch में करूँगा. But उसके बाद exam आएगा, we will be giving our entrance exam. About 40% of candidates will get their dream branch and they will be so happy. फिर 20% को क्या होगा, they will get a very good rank than they expected. So उनको they will make a choice like I will upgrade my branch. ऐसे करके they will take. Remaining 20% क्या करेंगे, उनको रैंक थोड़ा कम आएगा. फिर they will take जो भी branch है, मुझे next time exam नहीं लिखना है, जो भी मिल रहा है मैं ले लूँगा. And remaining 20% will go for next. So everyone will be having some adaptation issue during their initial period of post-graduation. For example, I was so much interested in general adult medicine, but मेरा rank में मिला नहीं था, so I took pediatrics. And my first posting was neonatology. I was so much afraid to handle those little child neonates, and initially that was so stressful to memorize those pediatric doses. But at one point, after some 7 to 8 months, I got adopted to these branches, and I was so much addicted to pediatrics that I became so passionate. So no matter what the branch we take, we will be doing miracles and wonders in our own branches. So there is no need to be so much stressed on our own branch. Then next factor is, this slide I have specially made for the residents, junior residents. Long hectic working hours, peer pressure, high pressure environment, homesickness. Not only in medical branches, it will occur in all professions. Even if you take a daily wage worker, they will also have hectic work. They will also have very high work pressure. Everything will be there. But at last, all these are part and parcel of our training program. So what I suggest is we should go through this phase. This will make us stronger at the end. And third pressure is financial pressure. As our age advances, we will become so much responsible. हमको ये दिक्कत आएगा कि finance क्या करेंगे, आगे कैसे settle होंगे, living expenses will be there, there will be family commitments. But at this point of time, there is no need to worry, no need to get so much stressed of these financial pressures. Everyone will tackle this. But at one point of time, we will be so much adapted to our branch and we will be doing good. Our academics will improve and we will be doing some research works and all. फिर उसी टाइम अचानक से दिमाग में आएगा सेल्फ डाउट. उसके बाद क्या करूँगा, how will be my jobs, what will be my salaries and all. So the point is, if we do good in our own branch, we will shine at last. This is the one. So there are some of the strategies. First and foremost is self-care. Our mental health is the first and foremost priority, and we should support our colleagues also. Peer support should be there. Whenever we need help, we should seek help. We should approach our colleagues, seniors, consultants, everyone. Everyone is free to help here. And we should make our working environment in such a way that it should be so friendly, so calm, so soothing. And this can improve and this can help us to tackle all these hurdles. And ultimately, we can make our post-graduation so pleasant and so memorable. Thank you.
Thank you, Dr. Kanda, for your motivational talk for our aspiring students. Now, I would like to request, now we'll have a panel discussion. So I would like to request our moderator for panel discussion, Dr. Sanjana, on stage.
Good evening, everyone. So our theme for today is making learning enjoyable. So we will be having a panel discussion for the same, for which we have our esteemed faculty and one of our MD PhD student with us, for which I invite Dr. Abhishek Bhardwaj sir, Head of Department and Professor Dermatology, Dr. Praveen sir, Additional Professor in the Department of Pediatrics, Dr. Rangarajan sir, Assistant Professor in the Department of Radiology, and Dr. Sarthak Gupta, who is currently pursuing his MD PhD course in anatomy. So we have been discussing about the learning methods and learning process. So we all know that that there are many innovative methods for learning and some conventional also. And the technology has also been a part of our medical science as well as learning experience in the recent past. And as well as we all know that this learning experience has a very positive impact as well as it can lead to a negative impact on a student. So we will be discussing about the same. So first, I would like to ask Dr. Praveen sir to highlight some strategies which can make learning more enjoyable for the students.
Hello. Good evening to all of you. So it could be multi-prongs, and it could be but I will discuss only what we usually practice in our fields. So first of all, we should remove the fear between the student and teacher as much as possible, and at the same time we should maintain the discipline also. And this can be done in many ways, maybe formal, informal. Informal talking, हाँ जी आज नाश्ता किया कि नहीं किया, नाश्ता किया कि नहीं है, कैसे हो तुम, तुम्हारी तबीयत कैसी है, तुम्हारे घर पे लोग कैसे हैं. And it may be sometime party in the week or in the month, birthday, celebration of the birthday. So we should make as less as friendly environment between the student and teacher. So it will make more enjoyable. Second thing is that the teaching should be more interactive, more on the, as in a clinical division, more beyond the class bedside teaching, more on conversations. Visually break the topic. If I teach the suppose cystic fibrosis, I will give just one topic. आज हमें यही करना, just respiratory presentation. Then next time we will do on another topic. So we can break the topic. We can discuss more on that topic. Third is that we should praise the junior resident or the senior resident, whoever the making new findings, have learned something, have read something and given some input into it. So we should praise in front of the other colleague, other PG student. Fourth, what I think we should give we should make them part of the team, not just writing notes कि हाँ आपको notes लिखना है. Suppose a patient come to us, suppose the child come with a fever, with a lymphadenopathy, and we are not making any diagnosis, we are not able to reach the diagnosis. So chalo, we all should read on that as a faculty as well as the student also. Again we will discuss again what could be the possible diagnosis, and they all will come together on the next day and discuss each and every topic, and then make so that they feel proud also. If they came with the reading and they make a diagnosis, they make proud them, they make more enjoyable also. And lastly, I will say give rewards. Every step, suppose he had to put IV line. Even if put at the first IV line, give reward. Maybe in the many form. You might just give the praise also. Give some party, a small party, or maybe just a reward also. Another type of reward is that suppose one of the resident done a very good work and he is the new finding, you can write a case report also and give the first author also. So they feel also yes, I have done the very good thing and it is enjoyable. So there are many, but what I think these are the important one which I would like to discuss here only.
Yes, sir. Very rightly said, sir. Even I remember that I have studied from you. So like when sir used to teach us in rounds also, he used to discuss the differential diagnosis very nicely. Like He used to praise also, and positive reinforcement used to be the maximum. So that a supportive environment is needed. Very rightly said, sir. So for my next question is to Abhishek Bhardwaj, sir. Sir, like we all know that since our childhood, exams, we all are afraid of exams. Like we will be evaluated in exams, judged. So we are stressed about the exams. So what can be the newer assessment methods or evaluation methods that can make learning enjoyable for students and engage them well?
Assessments are troublesome for everyone, not only students. More for students, but it is equally troublesome for teachers also. एग्ज़ाम्स को इंटरेस्टिंग बनाने के कुछ तरीके हमारे यहाँ ऑलरेडी हैं इंस्टीट्यूशनल. हम एग्ज़ाम्स में ऑस्की लेते हैं, ऑब्जेक्टिवली स्ट्रक्चर्ड क्लिनिकल एग्ज़ाम होता है. इट्स नॉट रोट लर्निंग because you are being visualized, observed for a set of activities in a set manner. One of the tarika is that. The other is gamifying assessment. Gamifying assessment would mean आप लोगों को ज़्यादा अवेयरनेस है ऑनलाइन कुछ प्लेटफॉर्म्स हैं जैसे Kahoot है, उस तरीके से आप टॉपिक्स पढ़ा करके सवाल जवाब कर सकते हैं. तो उसमें एक इंसेंटिव भी रहता है कि भाई फर्स्ट सेकंड थर्ड आना है, मार्क्स दिखते हैं, टीम की तरह रहता है. तो वो एक इंटरेस्टिंग तरीका है असेसमेंट करने का. पर्सनली मैंने नहीं किया है, आई विल अग्री, बट जो लोग हमारे यहाँ आते हैं पोस्टिंग्स में उनको हम फोटोग्राफ्स दिखाते हैं प्रोसीजर्स की. प्रोसीजर्स तो वो लाइव देख रहे होते हैं, बट उनके आउटकम्स की कि ये कौन सा बैक्टीरिया, ये कौन सा स्टेन है, तो वो वेरी करता रहता है. तो इसको आप एग्जैक्टली क्रैम करके नहीं आ सकते, क्योंकि क्रैम लर्निंग तो जैसा वो दिखा रहा था निर्मित साइक्लिकल है. एग्ज़ाम से पहले लर्न किया, एग्ज़ाम हुआ, उसके बाद सब गायब. तो वो मोटिव नहीं है टीचिंग का. तीसरा चौथा तरीका हमारे यहाँ स्किल लैब्स हैं. सिमुलेशन बहुत अच्छा तरीका होता है, या एक नॉर्मल इंडिविजुअल को एज अ पेशेंट दिखा करके उस पर सवाल पूछने का भी एक तरीका हो सकता है. वो भी होता है कई जगह आप लोगों के यहाँ असेसमेंट में. डर्मेटोलॉजी में वो हमारे लिए थोड़ा डिफिकल्ट हो जाता है क्योंकि हम लीजन्स को एक्चुअली पेंट करके क्रिएट नहीं कर सकते. तो यही हैं 2-3-4 तरीके. बाकी स्टूडेंट से कुछ फीडबैक मिले तो बिल्कुल वी लाइक टू चेंज अ फ्यू असेसमेंट वेज.
Yes, sir. As you highlighted, simulation-based learning, it is an evolving topic, and like in medical field, even for patients also, we are using simulation-based learning nowadays. So yes, it will definitely be helpful more in the future as we have advanced mannequins available with us. My next question is to Dr. Rangarajan, sir. Sir, how do you suggest that we can use the advancement in technology that is happening? Like we are seeing in the post-COVID era, especially the like webinars were being held, and all these. This has revolutionized the process of learning. So, how do you suggest that all this can help in innovative methods of learning in the future?
Yeah, that is a very pertinent question in these days. Nowadays, technology has become immersive as well as intelligent. So how do we capitalize that technology and the shortening attention span which is there with these students is, one is by the use of webinars, as you said. So an easier method is by the use of social media like Twitter and Instagram. So Twitter or X has now got many tutorials, and it's very popular among the fraternity that you have a short tutorial which is basically 5 or 6 tweets which just gives the most important concepts about some disease and a relevant paper which the student can then read. So one is that. Second is a short Instagram post which has more of a role in visual based subjects like dermatology or pathology or radiology, for instance, where you show a disease or a lesion in 3 minutes or something and describe about it. Second thing is, as Sir said, simulation-based learning. Simulation-based learning is not only mannequin-based, it can also be a desktop or a laptop-based, where you are given a clinical situation and based on the choice that you make, the further situation modifies itself and then goes on to progress and see how the patient fares at the end of the treatment that you choose. Much of the exams, the foreign board exams are also become much more online and without a physical examiner who is present, so that the concept of the examiner judging you is taken off, and the exam becomes much more objective, where you are just sitting facing a screen and not a physical examiner. डरावना सा माहौल नहीं होता है, and use of much more games on the apps. Like for instance, in radiology, it's very essential that you have to differentiate between the grays and blacks and whites. So you have some game called Blendoku, which helps you to make that skill better. That is, you are able to identify between the colors. So this is how technology is picking up. So if we just randomly scroll around, we'll find some app which can be useful for our specialty students or the medical students in general, and then try to make use of that app while teaching students. That's how technology is going to help you out.
Like social media is now so rampantly
Yeah.
used, so students can benefit from that also. So now I would like to request Dr. Sarthak Gupta to highlight his experience in MD PhD course. He has currently submitted his thesis in MD and is pursuing PhD dual course.
Well, as we know that in medical science, anatomy is everywhere. So when I joined this prestigious course, I had the opportunity of joining the PhD course as well. So during my data collection for MD, I was guided by expert faculties, from which I found that the anatomy of the coronaries in detail, I did morphometry, and I realized that studying the anatomy in more complex detail using latest technologies and different integration of departments helped me realize a lot. So I was able to explore this further in my PhD and study this on molecular level. And as an anatomist from a non-clinical field, to be able to integrate with the cardiology, radiology, and genetics is a privilege for me, and I've been able to learn a lot from it. So the learning, helps increase the level of the anatomy as well as I'm able to contribute to the cardiovascular medicine as well. So and there's no denying that the career prospects are also better joining this dual degree course.
Okay, thank you. Thank you, sir. It was a nice discussion about if any of you want to share your experience with any of your teacher that you think that was like enjoyable during your PG time or UG time that you think should be implemented.
One thing we did have in our PG time was integrated teaching, that is being followed here in AIIMS Jodhpur
sir.
also in a very good manner. So that helps you, that helps the department integrate themselves, as well as it gives a comprehensive view to the student of how to treat a disease in entirety. It's not just that you read pathology today and 1 year later you are reading about the medicine of what is to be given to that. So that helps make the concepts more concrete in the brain, and like the concept of this is to create more dendrites. So that is a very good thing I remember about my undergraduate days.
Exactly, sir.
So when I was doing the senior residency in AIIMS New Delhi, what we find during the class, inter class, they bring some snacks, snacks and tea during the class, especially the afternoon class, evening class. It make learning more enjoyable. It make two purpose. Some of the students do not do any breakfast also, and some also skip lunch. So that also fulfill, and apart from that, it also make very enjoyable. We try to did here also sometimes we bring a tea at the time in classroom, but it is not always a success be in this. We try to do it. We try to implement here also.
Yes, sir. Residents are always running hypoglycemic here.
Yeah, I think we all have teachers whom we have very vivid memories of. But I think वो हमारा डिस्कशन लंबा चलेगा. हमने गेस्ट स्पीकर बुलाए हुए हैं, उनका अनुभव भी सुन लेते हैं ना.
Okay, sir. Thank you all.
Thank you to all the respected panelists for their expertise. We now move to our next session. For this, I request Dr. Vidhi Jain Ma'am, Associate Professor, Department of Microbiology, AIIMS Jodhpur, to please come on stage to share insights on best practices in holistic development of students.
Good evening. We've already heard some experts on the floor, and we know many things that we are supposed to do. But in the next 5 minutes, I will try to put it into practice what we have just discussed. तो वैसे तो हमने बहुत सारी चीज़ें बात करी कि हमें इम्प्लीमेंट करनी चाहिए टू हैव होलिस्टिक लर्निंग, लेकिन हम चूज़ करते हैं कि अगले 5 मिनट में कुछ ऐसे सवाल करेंगे जिनके जवाब में हम सबको इन्वॉल्व करेंगे. जैसा कि हमारे एक्सपर्ट्स ने हमें पॉइंट आउट किया कि छोटे छोटे क्वेश्चन पूछने चाहिए, एक क्वेश्चन एक जवाब, और जवाब देने के लिए कुछ इंसेंटिव भी होना चाहिए, तो कुछ चॉकलेट्स भी हमने अरेंज करी हैं. एंड लास्टली हमारी कोशिश होगी ऐसे सवाल या जवाब हों जिनके कोई करेक्ट आंसर्स नहीं हैं, हम बस सबके ओपिनियंस जानना चाहते हैं, और जो बेस्ट प्रैक्टिसेस हैं उन्हें इम्प्लीमेंट किया जाए. तो जो बेस्ट प्रैक्टिसेस नाम और हॉलिस्टिक अप्रोच का नाम आया है, ये तो सब यूएस, यूके एंड जापान के टर्म्स हैं, जहाँ वो कंसिडर करते हैं कि स्कूल एजुकेशन, प्राइमरी एंड सेकेंडरी एजुकेशन में सिविक सेंस, एम्पथी, राइट एंड रॉन्ग, सोशल प्रैक्टिसेस उनको इनबिल्ट कर दें अलॉन्ग विथ स्ट्रेस मैनेजमेंट. तो बिल्कुल परफेक्ट मॉडल हो रहा है. तो स्ट्रेस मैनेजमेंट हमें पहले से ही आता है, स्ट्रेस होने से पहले, और फिर उसके बाद जब हम प्रैक्टिसेस में जाएं, फॉर एग्जांपल अंडर ग्रेजुएट ट्रेनिंग में जाएं, तो 2-3 साल में, 3-3.5 साल में अपना अंडर ग्रेजुएशन ख़त्म कर लें, पोस्ट ग्रेजुएशन और 2 साल में ख़त्म कर लें, क्योंकि स्ट्रेस मैनेजमेंट और पेशेंट डीलिंग तो हम पहले ही सीख चुके हैं. लेकिन हम तो इंडियन सिनेरियो में हैं, यहाँ हम थोड़ा सा डिफरेंट सीक्वेंस में करते हैं. पहले हम डॉक्टर बन जाते हैं, फिर हम अच्छे डॉक्टर बनने की कोशिश करते हैं, और जो होलिस्टिक लर्निंग है वो तो हम अब तक करते हुए आ रहे हैं, और उसे इम्प्रूव करने के लिए कुछ क्वेश्चंस पूछे जाएं जिसमें ऑडियंस को इन्वॉल्व करें. एंड आई वुड रिक्वेस्ट डॉक्टर तेजस्वी एंड डॉक्टर नीता टू काइंडली कम फॉरवर्ड. ये अगले 5 मिनट में आपके टॉफ़ी लोग हैं, तो जो जो आंसर करेगा उसको एक टॉफ़ी या चॉकलेट दे विल बी प्रोवाइडिंग. बट आंसर आप सिर्फ 2 माइक्स में कर सकते हैं. एक माइक यहाँ पे इन फ्रंट जो सर्कुलेट होगा, और एक वहाँ पे फिक्स्ड माइक है. तो आई विल ट्राई टू इन्वॉल्व एवरीबडी प्रेजेंट हियर टू गिव अस लिटिल टिप्स एंड इनपुट्स कि जो हमारा डेली का कारोबार होता है इस मेडिकल एजुकेशन, मेडिकल प्रैक्टिस एंड ऑल में, उसमें एक्चुअली सामने वालों के ओपिनियन क्या हैं. तो क्यों ना हम स्कूल स्टूडेंट्स से शुरू करें, और आप में से कोई जना हमें आंसर करके बताएगा कि अगर आप एक डॉक्टर से मिलने जाते हैं किसी वजह से, कि आप खुद बीमार हों या आपके फैमिली मेम्बर्स जो बीमार हों, जब आप डॉक्टर को देखते हैं तो आपके हिसाब से उसने क्या पहना होना चाहिए. फटाफट कोई जना आओ और यहाँ पे आंसर करो. इफ़ यू आंसर यू विल गेट अ चॉकलेट. कम. कि आप जब डॉक्टर के पास गए, आप क्या एक्सपेक्ट करते हो कि डॉक्टर क्या पहन के आया है? आ जाओ क्विकली, कम ऑन. आप स्टूडेंट्स इतने एंथुजियास्टिक हैं. कम प्लीज प्लीज क्लैप फॉर देम. वेरी नाइस.
एप्रिन और स्टेथोस्कोप.
स्टेथोस्कोप पहना हो और
एप्रिन.
एप्रन. वेरी नाइस. प्लीज सिट. शी हैज राइटली आंसर. प्लीज उनको एक चॉकलेट दीजिए. कोई और स्टूडेंट बताएगा? एप्रन और स्टेथोस्कोप तो ठीक है, कुछ कपड़े भी पहने होंगे. तो व्हाट काइंड ऑफ क्लोथ्स डू यू एक्सपेक्ट कि अगर जेंटलमैन डॉक्टर हैं, जेंट्स हैं, तो उन्होंने क्या पहना होगा? खड़े होके बताओ. नाम भी बताना अपना.
हैंड्स ग्लव.
क्या पहना हो?
हैंड्स ग्लव.
ग्लव्स है. कपड़े भी क्या पहने होंगे?
वाइट कोट.
वाइट कोट, उसके अंदर कपड़े पहने.
शर्ट.
शर्ट पहनी होगी और ट्राउजर, और या जीन्स. कुछ भी बोलो यार. व्हाट यू थिंक? जीन्स पहनी हो? ओके. उनको प्लीज चॉकलेट दें तेजस्वी. ओके. एनी अदर स्टूडेंट? अगर एक लेडी डॉक्टर के पास आप जाएं तो आप क्या एक्सपेक्ट करेंगे कि वो लेडी डॉक्टर ने क्या पहना होगा, तो आपको फील आएगी कि हाँ हम डॉक्टर के पास गए? बताओ, फटाफट बताओ स्टूडेंट्स. आई नो यू आर वेरी इंथुजियास्टिक. घबराओ मत. यस, प्लीज स्टैंड अप एंड टेल अस. उनको माइक उधर प्लीज दे दीजिएगा. वेरी गुड.
मे बी साड़ी और कुर्तीज.
और
साड़ी.
साड़ी. ओके. प्लीज सिट. नाउ कैन वी हैव द पोस्ट ग्रेजुएट्स? एनी पोस्ट ग्रेजुएट जेंटलमैन, व्हाट वुड यू लाइक टू वेयर टू द वार्ड दैट यू नो कि सुबह 6 या 7 बजे से तुम वार्ड में हो? एंड ब्रेकफास्ट वगैरह की बात तो बाद में आएगी. नाइट ड्यूटी का काम खत्म करके यू आर कंटिन्यूइंग विद अ नाइट, एंड इन द मॉर्निंग ऑल्सो राउंड्स खत्म करे बिना, ओवर दिए बिना तो जा नहीं सकते. व्हाट वुड यू लाइक टू वेयर? Gentlemen, please, I would like one person to answer, and of course there are chocolates waiting. One gentleman, please stand up and answer. Come on, the students have been so enthusiastic. यार PGs पीछे नहीं रह सकते. खड़े हो चलो. Yes, please answer. You can come to the fixed mic or you can take that mic.
Like already they are in so hurry and worry, so I think they should go for scrubs.
Good, point well taken. Anybody else? Okay, हो सकता है you are from a subject जिसमें scrubs नहीं पहनते. क्योंकि scrubs तो basically OT, anesthesia, other specialties will wear. Any other clothing that PGs would find comfortable? For a lady PG or for a gentleman PG? क्या पहनना है यार? पूरे दिन काम करना है आपको. क्या पहन के आप comfortable रहोगे? यार कम ऑन स्टूडेंट्स, 3 स्टूडेंट्स ने आंसर कर दिया और आप अभी सोच रहे हो यार बहुत बेइज्जती हो जाएगी बच्चों के सामने. प्लीज स्टैंड अप एंड आंसर. यस, प्लीज गो टू द फिक्स माइक एंड आंसर. योर चॉकलेट्स आर वेटिंग.
For females, kurti and plazo will be the best,
Okay, great.
as they are comfortable with it.
As they are comfortable. So with these answers, and Dr. Tejasvi will be giving you a chocolate, do we realize that the service we are offering is very valuable? But the people who are receiving the service have an expectation from us which is beyond the service itself. Somewhere ऐसा एक्सपेक्ट किया जाता है कि जब लोग डॉक्टर के पास जाएं तो राइट फ्रॉम दरवाज़ा खुलते ही क्या वो कमरा हो, क्या उसकी लुक हो, और जो बंदे जिसको वो देख रहे हैं, बंदा या बंदी, उसने कुछ पर्टिकुलर पहना हो, वो एकदम रिलैक्स स्टेट ऑफ माइंड में हो और आपकी वेट कर रहे हो और आपको इस तरह से देखें कि आपको लगे कि हाँ आप बीमार हो, आप एक एक्सपेक्टेशन लेकर आए हो. उस जने ने शायद आपको वन गो में ठीक नहीं किया, एक बार में शायद पेशेंट्स ठीक नहीं हुए, लेकिन उस एक एक्सपीरियंस से आप एक फीलिंग लेकर जा रहे हो ऑफ फीलिंग इम्पॉर्टेंट, ऑफ फीलिंग हर्ड, ऑफ फीलिंग that the pain in your mind or in your heart was soothed by the way they approached it, right? And my last question here would be for faculty. That when we stand here as teachers, many of us, we are always in our hurry of work. How do you see yourself as a role model for others? Say 10 years ago, we were also students who would be probably sitting on this side of the hall, right? Somewhere, sometimes we did not think of ourselves to be role models. But the way we appear to our students, we have to appear both as a teacher as well as a learner, and somewhere teaching them that this is how you are supposed to be. So can I have any input from any faculty who would like to discuss any challenge that they feel in giving their overall input by just being there? What are the challenges by which we wish we could teach our students being something, but we have to be that person first before we teach? So any faculty who would like to share 1 or 2 challenges they feel in becoming role models for their students? Any faculty? We have fixed mics, we have fixed mic here, fixed mic there, and of course we have chocolates. आप आगे ले आइए mic. I think Sneha ma'am would like to answer.
गुड इवनिंग ऑल. मैं अपना एक एक्सपीरियंस शेयर करना चाहूँगी. व्हेन आई स्टार्टेड टीचिंग इन अ कॉलेज, वन ऑफ माय कलीग सेड कि मैं जब क्लास लेने जाती हूँ तो हम जब बच्चों से पूछते हैं कि आप ये चीज़ बताइए, आप ये चीज़ बताइए, तो लेकिन जब टीचर आता है वो तो अपने साथ इतना बड़ा पैम्पलेट लेके आता है, इतने 4-5 पन्ने लेके आता है और उसको देख देख के पढ़ाता है. एंड दे एक्सपेक्ट अस कि हमें वी शुड नो एवरीथिंग. एम आई राइट? इट that was my first experience as a teacher. Then I decided, there are so many, my students must be here. Then I decided I will not take any, वो क्या बोलते हैं, पर्चा, when I will take the class. And that still I'm following that. So that is there. That I.
Amazing. I think we have time to take just one more faculty experience.
Okay,
Any
thank you.
faculty would like to discuss the challenges of being a role model for somebody else. Can we have any of the senior faculty share the experience, please? Any faculty? So if we could have any of you say just a few words. your challenges of being a role model to others. Any other faculty who would like to step up? We have just time for one more experience. I think Dr. Kuldeep would like to say something.
आई थिंक जो आपने इस तरह के क्वेश्चन पूछ के सबको पशुवेश में डाल दिया है बिकॉज स्टूडेंट भी ऐसे ही होते हैं कि पता नहीं मुझसे क्या पूछ लें तो स्टूडेंट्स का जो लर्निंग होती है वो फिर सबड्यूड हो जाती है तो वो एक्सपेक्ट करते हैं क्वेश्चन ना पूछा जाए मुझसे ऐसा भी हमें आता है
So I understand,
thank
sir.
you.
But these are the challenges in making our lectures interactive. And while at the end of the day, all students want an interactive session. But as sir said, कोई चाहता नहीं है question पूछे. So I think it's most important that we always ask open-ended questions. Questions that don't have right or wrong answers. They are mostly dependent on experience sharing and maybe something with which all the audience can associate or relate. So that was our attempt to put best practices into motion. And thank you so much for being such a great audience. Thank you.
Thank you, ma'am, for such an interesting and informative talk.